This conference will now be recorded.
Welcome in, everybody. On this lecture, we are going to be talking about lifespan development, which is correlated to Chapter 9 within your textbooks. So what we're going to be talking about is both the physical and physiological changes that occur for somebody progressing through life. We're also going to be talking about vital signs and how they correlate to each different age group. So first, we're going to be talking about the neonates and the infants. So for age range for them, this is going to be birth to 1 month of age for the neonate, and then 1 month to 1 year of age for our infant patients. So when we're looking at vital signs, we can see the differences as far as respiratory rate, heart rate, blood pressures. Body temperature is going to be pretty consistent throughout all of our different lifespan developments. But as a younger age, what we do is we breathe faster because we need a little bit more oxygen content. Our heart rate is going to be faster. Blood pressure is going to be lower, because of that systemic vascular resistance, which I talked about in pathophysiology. Another component of why these vitals are different is because the amount of blood volume that's actually circulating through the system. Remember, with our infant, we're looking at about less than a pop can worth of blood volume compared to our adult, which is going to be at 5 to 6 liters. So we're looking at the physiological changes. The infant airway, significantly shorter, narrower, less stable, and much more easily obstructed compared to the adult patient's airway. Really think of their trachea kind of like a straw. If you bend it any which way, it's going to be compromised, and as a result, that patient's not going to be able to breathe adequately. Then when we're looking at the cellular respiration level, it is undeveloped at this time. So again, it takes more oxygen content in order to create that ventilation and perfusion ratio. Our immune system for our infants and our neonates, extremely underdeveloped and very immature at this point as well. That's where they are much more prone to illnesses and diseases. And then as far as physical stuff too, their skin isn't as strong in order to fight the invaders that are coming into the system. Now, when we're looking at the central nervous system, instantaneous and involuntary movements. So they're not able to support their own body weight. They don't follow motor commands. They're not developed both within the brain or the spinal cord at this given time. So here, great example of the differences between the adult airway anatomy and then also the infant airway anatomy. So we can see how easily that airway is obstructed for the infant. Best thing that we can do in order to maintain a nice patent airway is simply pat underneath that patient's shoulders, because that will compensate for that patient's extremely large head. Other differences, we can also see the size of that patient's tongue too, in comparison to the size of the oronasopharynx area. And then with motor development, so we can see with the neonate, that 0 to 1 month, very little motor development, very little movement. Now, once that neonate turns into an infant and they're starting to walk and crawl, this is where we're going to see more prone to injury based on falls and different correlations like that. Now, with psychological changes, they are beginning to develop relationships, and this is going to be primarily with the parents. Now, they start to develop those relationships while that neonate or fetus is still in the womb. Oftentimes, they can recognize the voice tone between mother and father at that point if they're heavily involved. Things that we can see as far as negative influence, basically diet, and loving interaction is really going to make the neonate and the infant grow substantially within that first 0 to 1 year. So a lot of negative consequences occur in the event that there's no loving interaction between the parents or primary caregivers and that neonate or infant, and it really hinders the growth of that individual, both on a physical level and on a psychological level. Now for communication, again, their frontal cortex is not developed yet, their brain is not developed yet, and as a result, crying is going to be their primary mode of communication, kind of like a dog barking. That's their primary mode of communication. So they're wet, they're hungry, they're tired, that is going to prone that crying, and as a result, that's their communication level. Now, when we are dealing with infants and neonates, be very supportive of that patient's head when you are transferring them, and be cognizant too of how you're handling them and what you're wearing. So for this rescuer, he's wearing his turnout gear. Don't know the exact occurrence of what happened here, but turnout gear, we have a lot of different particles and chemicals on there. Remember that infant neonate, that immune system is not developed yet. From that age range, we then move up to our toddlers and our preschool age children. Our toddler is going to be in between the ages of 1 and 3. And then our preschooler is going to be in between the ages of 3 and 6. So for vital signs, what we're looking at, our respiratory rate and our heart rate is beginning to come back to the normal adult values, or they're lessening. Now for the blood pressure, it's starting to increase because we're building up that systemic vascular resistance. We're starting to see an increase in blood volume, which again will correlate with our respiratory rate, and our heart rate starting to drop a little bit because we have enough blood volume to properly perfuse that patient's system. With physiological changes, what we're going to see by age 3, they are going to be able to walk alone and begin to run. Again, we're going to start to see more traumatic occurrences for this age group. They can start to pull and or carry. Again, trauma is the big one. We have a pot of boiling water on the stove. School-age children or a toddler will be able to reach up there and pull that off. So we see quite a bit of burns with this age group as well. Climb up and down furniture. They can start to play with toys, and then also recognize. So this is a big thing too, where in this age group, they're starting to be taught and told about stranger danger. So they're being able to recognize individuals who are in their life and recognize individuals who are not in their life. So being able to carry yourself adequately as an EMS provider, create that culture of comfort, really goes a long way when we are dealing with patients in this age range. They can find objects and sort objects. This is where those building blocks are starting to come into play, and they're going to start to develop both that mental aspect and also that central motor movement as well. Now by age 5, we're going to start to see some drastic changes too within physiological. Motor movement, muscle mass, that's going to start to grow. They're going to be able to stand on one foot, not food. They can hop, jump, swing. They can start to dress themselves and undress themselves. However, that has not gotten to me yet because I dress in sweatpants almost every day. They can start to count, use utensils, trace and draw. Again, pretty drastic changes for that psychological by age 5 when you compare that motor movement for that neonate patient. Now, as far as psychological changes, this is going to be where language is going to begin to develop. Now, oftentimes for this age group, it's still difficult for them to interpret exactly what they're feeling, what is hurting, different things like that. So your patient assessment is still hindered, but they can communicate with you on somewhat of an appropriate level. They can start to solve simple problems. Again, their education is going to really take a jump at this point. Social skills are developing. I mentioned this on that previous slide where we start looking at the stranger danger aspect. In uniform, we can kind of be almost a threatening presence, so trying to bring that softer side to how you carry yourself really goes a long way within properly assessing and treating our kiddos. They can express feelings, but again, not very well. At this age group too, they are extremely curious, and oftentimes many of them have had negative impacts when dealing with doctors and being at clinics. So they are terrified of getting shots because they associate that pain level with anybody who's operating within the medical field. So a good tip you can do is show them and demonstrate what you're going to do to them prior to actually doing those different interventions. So if you're going to put the pulse ox on, show them the pulse ox, let them play with it a little bit, and then put it on. Now with school-age children, we're increasing that age. They are going to be in between the ages of 6 to 12 at this point. Vital signs, we're going to start to see that respiratory rate drop a little bit. Normal range 20 to 30, heart rate 70 to 110, and then our blood pressure again is coming up because of that vascular resistance. Body temperature, this is where we're going to maintain that homeostasis level of that 98.6 basically throughout the rest of the categories of lifespan development. Now with physiological changes, we start to see a drastic increase in calcium buildup inside the system. And as a result, we see those bones increase in density and size. So prior to the school-age children, as far as fractures go, oftentimes what we would see is what's called green stick fractures. So for those of us who have ever gone in the woods and there's a new sapling or a new tree and we take a branch off that tree and break it, and we notice it's still together and we see that green content inside, that's very similar to what's going on inside the bones when somebody fractures in between the ages of that 0 to 5, 0 to 6 mark. Now, when we start to see this growth within the school age children, this is where we're going to see the more traditional linear fractures or complete fractures because those bones are actually strong enough to completely sever at that point. Teeth being developed and then being lost into that adulthood. Start to see a drastic increase in brain capacity too, especially within the frontal cortex where they're developing that personality, starting to respond to humor and even a little bit of sarcasm. Be very careful when you are using sarcasm around any young age children because oftentimes they don't completely grasp that. Then with psychological changes, this is where they're going to continue to develop further relationships, where they're developing friends within the schoolyard, neighborhood kids, and then they're starting to branch out a little bit more on their personal levels with different types of authority as well. Start seeing increase in activities, sports, after school stuff. And again, this is going to really tailor their personality as well. Now we're starting to get to the age range where they can start delivering a better patient history and associated with what's going on inside their body. So they're a little bit better historian. Now, previous to this age, oftentimes we have to rely on what exactly the parents are telling us and then correlate that into our patient. Where we reach this age range, we can get a little bit more understanding of what's actually going on with that patient and not relying from a third party like a caregiver or a parent. Next age range, we're going to be looking at the adolescent age, which is going to be in between 12 to 18 years of age. Our vital signs are going to be almost identical to that we see in the adulthood phase of life. So our respiratory rate is going to be in between 12 and 20, heart rate 55 to 105, systolic blood pressure is in between 100 to 120, and then our body temperature again is 98.6 degrees. Now with our physiological changes, what we're going to see, the marks of puberty, going through and kind of ending that phase. So what they classify as puberty, at least with the American Heart Association, for males, they're going to say it's the start of armpit hair. For females, it is going to be the beginning of breast development. Now remember, females oftentimes will start to go through puberty first, males second. Start to see a muscle mass and bone growth with that puberty phase, because again, we're introducing quite a bit more hormones inside the system. Reproductive organs develop. Now, with psychological changes, we see a drastic change within the psychological changes of this age group, and it can be very difficult to properly assess the patient because they're dealing with negative ramifications for telling the truth from their parents and or caregivers or any type of authoritative figure. So with them, they drastically and desperately want to be treated as an adult. For those of you who can remember back when you were in that age group, it's, I'm an adult, blah, 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 but actually you're not. You're not developed yet to actually make those decisions. And then by law, if they are under the age of 18, they cannot make those decisions for themselves either, unless, of course, they're an emancipated minor. They're going to start to develop that identity and again create that personality. And then we can start to see the drug and alcohol experimentation. With kids, I mean, it's one of those things where you got to stay up to date on different trends within drugs and alcohol because they find different ways in order to abuse those drugs and abuse those alcohol substances. Now with early adulthood, we're starting to meet the peak of physical and psychological performance. So our early adulthood is going to be in between the ages of 20 to 40. Our vital signs are going to be at that peak performance. So respiratory rate is going to be in between 16 and 20. Heart rate average is right around 70. Blood pressure 120 over 80. And again, we maintain that body temperature of 98.6 degrees Fahrenheit. With our psychological changes, what we're going to see, again, they are operating at that optimal level, reaching that peak physical condition. And this is where we start to see lifelong habits develop. Lifelong habits such as diet, exercise, alcohol use, tobacco use, and drug use too. So this age group really reflects upon the later adulthood phases of how we developed our lifelong habits at this specific age range. Now with psychological changes, they're becoming adults, they're starting families, they're buying houses. This is one of the highest levels of stress because they're getting out of that college atmosphere and then getting into actual adulthood where they are purchasing a house and paying all of their bills. Family is going to begin to get developed. Now with middle adulthood, leaving our early adulthood, and we're getting into the age range in between 41 and 60 years of age. Vital signs, very similar to that of the early adulthood. Respiratory rate's the same, heart rate's the same, blood pressure and body temperature are all the same. With psychological changes, this varies drastically in between different age groups. We can see a drastic change within their cardiovascular health depending on genealogy and then also depending on those lifelong habits that they developed at that early adulthood phase. We see a drastic increase in patients who get diagnosed with a variety of different cancers, and then we see a big weight gain. So with patients who are over the age of 30, the kind of textbook definition is after age 30, every year our organs deplete by 1% productivity. So if we're at the age of 40, our organs and everything correlating to those operates at about 90% level, and then it continues to decrease after every year of age. Now with psychological changes, they desperately want to help the younger generation develop, because a lot of their kids are going to be in that adolescent phase or that early adulthood phase. So they want to share the wisdom and knowledge that they have received over the years of being here. They're going to start to reach those goals as far as lifelong goals, and they may delay seeking help. So this is a very stubborn age too, where somebody's at that 50-year mark, they're developing chest pain, and they may think that there is no way that this can happen to them. Then our last stage of life is going to be our late adulthood. So this is going to be 61 years of age or older. As far as their vital signs go, it is all dependent upon their lifelong habits, disease processes, and that current health state that they're currently in. Psychological changes, we see some major changes in cardiovascular health, respiratory health, and we'll dive into a lot of the physiological changes once we get to the geriatric chapter within your textbooks. Endocrine changes, so remember the endocrine system is in charge of hormones, so we see a deterioration in that, and as a result, they don't produce as many hormones as the early adulthood or that middle adulthood phase. Musculoskeletal changes, so muscle mass depletes, bone density and strength decrease as well, so they are more prone to injuries from that musculoskeletal system not being able to actually protect themselves. Now, with psychological changes, a big component within our geriatric population is depression, anxiety, and suicidal contemplation. Patients are starting to be removed from their homes, and they are either living on their own with a spouse, living on their own as a widower. Also, we can see patients starting to move into assisted living or nursing homes as well. Dementia. So dementia is kind of a blanket term for a bunch of different diseases that are going to affect the mental capacity of that patient because that brain is going to begin to shrink. So a lot of their frontal cortex is going to start to be depressed at that point. And then, of course, wisdom. So with that geriatric population, they want to be treated with respect. Remember, they've earned it over the years of being a productive member of society and really building what we have today. All right, so that ends it for Chapter 9, which is lifespan development. I will see you soon. Thanks.